Did you know that pelvic inflammatory disease is one of the leading causes of infertility? Yet, so many people don't even realize that they have it until it's too late. Hi everyone, welcome back to the LyLu Health Podcast, where we talk about everything and anything health to do. Today we're going to talk about the pelvic inflammatory disease, which in short can be termed as PID, and that's the acronym that I'll be using from time to time. And we are so honored to be joined together by a special guest. He's called Dr. Seth Carl. He's going to briefly introduce himself, but for today's conversation, he's going to shed more light on everything you need to know about the PID, some of the signs and symptoms that you have to look out for in case you have it, the treatment regimes that you can start incorporating in case you realize that you have some of the symptoms that he will mention, and then, we'll just take it from there. So, Dr. Seth, why won't you... I'll just give it over to you so that you can introduce yourself briefly, and then I'll just kickstart with a few questions, and then we'll continue the conversation.
All right. So as you said, my name is Dr. Seth Carl, and it's a pleasure. Okay.
Okay, it's a pleasure having you today. That's all you want to share about yourself.
Yeah.
Where you are or your education background. You don't mind sharing that?
Well, let's just go.
I'll grab your social media handles. They will be stalking you. Okay.
All right, that's fine.
But don't worry. If you consent that, then. But if you don't, that's okay.
Yeah. And I can give out my social media handle. That is fine.
Okay. Yeah. So why won't you start by talking about what PID is all about for people whom this is their first time to hear about this terminology? Like, what is it about?
Okay, so when we say PID, PID is simply pelvic inflammatory disease. So it is the inflammation, the infection, female genital, which is the uterus, the fallopian tubes, adjacent structures, that is structures around that area. So that is basically, so the infection and inflammation of it, what we call pelvic inflammatory. And we have some microorganisms. Mostly it's caused by multiple microorganisms, call it polymicrobial infection. So the common ones, we have chlamydia, I think a lot of people have heard. We have gonorrhea, we have E. coli, we have Haemophilus influenza. But amongst all these, there are lots, countless. But amongst all these, the most predominant one is chlamydia, which is also sexually transmitted.
Yeah.
Right. Yeah. So these are what do you call it? The organisms that can cause PID. Right. So a little with regards to PID. When it starts, we have two stages. Basically, we have two stages. So we have the first stage, which is the asymptomatic. Asymptomatic basically means there is you don't show symptoms, don't feel any. Yeah, you are mostly presumed normal, like you feel okay, you feel healthy until you are not. So with this stage, it's where there is acquisition of the infection at the vaginal level. All right. So there is an acquisition, that is where you have the infection there, but it has not ascended to the upper structures yet. So that is the step one, and it's mostly the asymptomatic phase. And then there is
that step one is actually the most dangerous, because if you do not have the signs of it and you're sick, like
you will not.
How do you even seek treatment when you don't know that you're even sick?
Exactly. So the stage two is the phase where it attends to the upper genital organs. So the stage two, there is a direct ascent, like upward movement, the fallopian tube, and then the uterus. All right. Yeah. So there are some mechanisms that facilitate So, for example, the infection vaginal state sometimes causes inflammation, right?
Yeah.
And this inflammation reduces the ability of the cervical mucus. Causes there is something called cervical mucus. What is a It is like a mucus. I think we all know what mucus is. But then
Yeah.
this one, cervix, all right? So what are some of the functions of this cervical mucus? So during ovulation, right? It becomes thin, it has some micro which allows sperms to penetrate, all right, to go for fertilization. It also not filters some what do you call it, impurities in it. So this happens, this vitamin, it becomes thin during ovulation. But other periods cycle of the so it becomes thick. So
Yeah.
it prevents sperms from, all right. So that is basically the mechanism that helps that that helps with the ascension, or that helps with what do you call it, the bacteria going to affect our um, structures. One is the what do you call it, as I previously mentioned, the vaginal inflammation. It causes this cervical mucus to reduce in its, all right.
Thickness. Uh-huh.
And another thing is also using antibiotics. Most people like for reason which is not pre- also reduce barrier. Then we have hormonal imbalances during during sexual what do you call it? Let me just, there are some words I'm kind of forgetting, but I mean
No, it's okay.
during orgasm,
Oh, okay.
during orgasm it also helps. There is this contraction that also helps all that. So all these are some of the upward movement of these bacteria to the
Okay.
to
Okay.
the upper structures for it to get inflamed and all that. So now we
Okay.
can talk about some of the risk factors,
Yeah.
some of the things that we do that predispose us to
Mhm.
um, predispose us to the idea. So
And
we
who is
have,
most at and who is like the most vulnerable to
yeah.
facing these risks?
So we have younger people that,
Mm.
so young age. We have people with previous STIs,
Mm-hmm.
right? If you have a previous history of STI, you're at risk. Also, people with multiple sexual partners. So
Yeah.
people with a lot of sexual partners, they are at risk. People that practice vaginal douche, so the form of dildos or any other thing, can also lead to that. And also we have,
Practice deodos.
come again.
Did you mention like people who practice deodos? I didn't
I
catch
mean,
that well.
I
Oh,
said people that use dildos and all other stuff,
what are
penetrating them
deodos?
up there. Come again.
What are deodos?
Dildos are like dildos, um, artificially made penis. I'd say
Oh, okay,
they
okay. Like the
manufacture.
sex toys.
Is very good. Sex
Okay,
toys. Yeah,
okay, okay.
that is it. So, and also gynecological procedure, for example, with an IUD and all that.
Mm-hmm.
So, all these predispose one to contracting, we call it pelvic inflammatory disease. So, with this, what are the symptoms that someone
Yeah.
uh, is going to show in a person? So, when it gets to the stage where it has affected the upper genital tract, the person is going to feel feverish. So there's going to be fever. There's going to be lower abdominal pain. There's going to be purulent vaginal. There is going to be pain during sexual intercourse. All right. Sometimes nausea and vomiting. So, but it doesn't mean if you have these symptoms, PID. That is why you have to go to the hospital to be screened before. So other what do you call it, infections can also present similar symptoms.
Yeah,
But
it could
these
be
are
gonorrhea or something else.
exactly. So with regards to diagnosing or how health specialists, it's not just from the symptoms. We are going to take history. All right. So we take history on your day-to-day life, what you do and what you don't, and then we will do labs too. All right. So we do evaluation, then we merge them, then we can confidently diagnose someone of PID. All right. So with that, some of the complications associated with PID, we have chronic pain because it's painful. There is inflammation, so you feel pain, and the pain is mostly felt when you are moving, doing some exercise, anything activity. You feel it. It's very painful, and it's mostly back. You feel it there, lower abdomen area, like the whole part. Yeah, you're going to feel it there. Also, um, um, what do you call it? There is risk of ectopic pregnancy. So there is this thing there is this finger-like structure within the fallopian tube. It's called cilia. So cilia, the main function of the cilia is transportation of the ovum and also sperm. All right. So it
Yeah.
helps transport the sperm to the egg for fertilization. So if this cilia is destroyed and mostly destroyed by some of these bacteria that causes the what do you call it? It destroys the means of transportation
Yeah.
for the ovum and then the yeah. So mostly this leads to ectopic pregnancy, and sometimes since the cilia doesn't have it is no more function to transport the sperm to the ovum, there is no fertilization, hence there is infertility. You get me? And if it manages to even come there to fertilize an egg, since the cilia cannot it can move it back for implantation. So it stays up there, causing ectopic pregnancy. We get it.
Yeah.
Yeah.
And can you explain to the listeners who might be listening to this and they don't know what the ectopic pregnancy is about? Can you hear me?
So ectopic pregnancy is basically
Okay.
the implantation, right,
Mm.
of what do you call it, a fertilized egg outside the uterus. So usually when the egg come back to the uterus for implantation, for everything starts.
Yeah.
So when it doesn't come and it stays where it is, that is in the fallopian tubes there, up there, that is basically ectopic pregnancy. So ectopic pregnancy is basically when the fertilized egg does not stay within the uterus, then outside the uterus. That is ectopic pregnancy. Very good. And PID causes that. So PID causes infertility, ectopic pregnancy, chronic pain, and I think these are dangerous things to experience as a young lady, because I presume most young ladies want to get married, have their kids, having those dreams, an infection is quite terrible. Yeah. With regards to treatment, we have drugs. Thankfully, we have drugs that treat it. So we have a couple of drugs. If you go to the hospital, you'll be screened. And treatment of patients with PID, we have to mostly it is outpatients. It's based on outpatient basis. Basically, we treat you, we don't admit you. So you'll just be seen at the OP. You'll be reviewed and all that. So, but there are some instances where people with PID have to be admitted. And some of these instances are when the patient is really ill, or when the patient is pregnant, or when the patient is immunocompromised, or when the patient is unable to improve after 72 hours of outpatient therapy. All right. So these cases, we would have to you would have to be admitted. Right?
Admitted to the hospital, like for
Yes,
special
for
care.
special care. And
So
also, come again?
is that dangerous? Like you have to be in the hospital to be treated on
Yeah.
case.
Mm-hmm. And there is this called ovarian abscess. So there is an
So
abscess that is
ovarian.
there is an abscess, ovarian abscess, all right?
Mhm.
Yeah, so there is an abscess within the fallopian tube. But yeah, there's an abscess, and this due to the infection, all right? So it creates this pus and it's very dangerous, all right? So this abscess, when seen, might uh, um, most often might be drained. We have to drain it to keep you safe, or there has to be a
They have to be
surgical intervention. So either
okay to be
so
able to remove
when
that
when the
abscess.
infection gets worse, there is
Mhm.
peritonitis. Sometimes we might take out your entire uterus and your fallopian tubes. That is how bad it can be. All right. When
Wow.
the infection is severe, we have to take out the entire uterus. The entire that kills your chance 100% at
Yeah.
um, giving birth. So that is something short, something simple, concise about pelvic inflammatory. If you have any questions.
Yeah, you were speaking on the diagnosis and treatment, and that's the part you were like stressing more
Come in.
on talking about. You were talking about the diagnosis and the treatment, right? And how to manage the PID. And I want to also find out for the preventative and lifestyle changes if there are
Okay.
some
So
preventative measures women can take to avoid the PID.
okay. All right. So I think mostly if you try to think the opposite of the risk factors, what's
Mm.
going to, for example, reducing your sexual partner, it can be advisable to have a partner, avoiding frequent douchings, putting things here in your vagina, and then avoid the indiscriminate use of taking drugs, taking antibiotics when you've not really been doing anything. Yeah. So these are a few things that you can do to abstain. What do you call it, to save yourself. But I think the best way is like abstinence or keeping just one sexual partner.
And this means that most of the times when you're having like many sexual partners, you're susceptible to contracting the PID because
Mm-hmm.
maybe one of them is affected, and so that's how come you might get the PID. But is it possible that you can still be having sex with several partners who might not have the bacteria, but you still get infected?
No, so it's sexually transmitted. So
Okay.
the whoever you are having sex with should have these bacteria that we were talking about
Mhm.
transfer it to you. Yeah. So
And I'm
basically
also
that is it.
curious. I'm also curious. Like, is there a way to go and test for it so that so that the doctors tell you that, oh, I think you're free to do sex because you don't have
So
it. Like, it's like you test for the TS, like the STDs and
yeah, yeah,
no
yeah. So
AIDS.
mostly
It's
when
what I
someone
was looking
comes to the
for. AIDS
hospital,
stroke AIDS.
so yeah, so mostly we take your blood samples. We do
Mm-hmm.
there is this swab we call endocervical swab to swab the cervix. Uh, Send it to the lab,
Mm-hmm.
check for the bacteria if you find any, and we are going to do an ultrasound scan to find if there is any fluid fill. I said there was something called an abscess, right? An ovarian abscess. Yeah, so we will do an ultrasound scan to see if there is any there. And so these are things, but going to the hospital to check if you have PID. PID is something that you can't you are going to feel the pain. You get me? So you are obviously going to go to the hospital, but you being safe, you being home, going to screen, that is not something that is really out there. Yeah. So you can go for regular checkups. It's very good as a woman to go for regular checkups, to go for regular screening. If through the screening we find what do you call it? We culture some of these bacteria. Probably maybe they might be in the stage one, the asymptomatic stage. We can treat you for it, but mostly PID is something that comes with pain and all that. So if you don't feel pain, um, it's possible that you don't even have PID. Yeah. So yeah. So if there's no, but then there is this symptomatic phase, as I said. So and every human being, not just women, we are all supposed to go to the hospital for regular check and all that. So as I said earlier, if within the course of the checks we find out that you have there is this bacterial, some of the bacteria causing it, we culture some, then we can start treating you so that it will probably prevent it from probably advancing to the next phase. Yeah.
I think that's a good.
And also the most important thing, reducing the number of sexual partners, putting things inside your vagina and all that is put you at risk. Also taking anti indiscriminate.
And for the testing, I asked the question because I was just thinking, you see how for the HIV stroke AIDS usually, I think for couples mostly before they even indulge in sexual activities, I think it's advisable to go and test. And so for
Yeah.
these two, I was guessing like it should be the same fashion since it's
Yeah.
also
So
an STD, but it seems like
yes.
there is
Yeah. So
some.
as I'm saying, it might probably be most people that come to the hospital presenting with PID come with severe pain and all
Yeah.
that. But then
Mhm.
with the other aspect, it might be it will, that is, if you have it, be determined if you're having your regular screenings. Yeah. So
Yeah. Yeah.
we might know that probably you have some of the bacteria causing PID. So let's treat it.
Mhm.
But
Okay.
those that the infection has advanced, there is mostly pain, right? So there is mostly
Mhm.
pain, lower abdominal pain. There is vaginal discharge, which is very prevalent. There is pain during sexual intercourse or anything that involves a little bit of exercise, right? There is nausea sometimes. Yeah.
And do you think, like, how important is sexual health education and safe practices in reducing the cases of PID?
Okay. So I think it's very important in the
Mm,
sense that um, almost most of cancers and other infections with regards to the female health is caused by sexual intercourse, early sexual intercourse, multiple sexual partners. So I think with what do you call it, sexual health in that aspect is very important. People knowing best to attain, if not just keeping to one partner, is going to go a long way of helping you, the individual.
yeah, yeah, I totally agree. Like with education, at least you have like somebody is aware that if I'm having multiple sexual partners, these are potential things that can happen to me. So, but if you're not aware, and this is a disease that just come in muted, then you might just realize when it's too late, and then the
Yeah,
health implications that you're going to face is just enormous. You just be regretting for the rest of your life.
yep.
And I wanted to find like what kind of advice would you give to women who suspect they might have PID at the moment?
Okay,
Like,
so if you
would you
suspect,
refer them to the hospital, or there are
uh,
some things that they should do before they go to the hospital?
yeah, so if you suspect you have PID, the first thing is to just rush to the hospital. So
Mm-hmm.
go to the hospital. It might be something else. So we have
Yeah.
differential that other things can present as PID. For example, appendicitis or ovarian torsion, right, where your ovaries twist on its axis causes severe pain. All right. Yeah, we have cervicitis, inflammation of the cervix. So all these are possible things that can present as PID. So if you're having these symptoms, you can't just go for drugs or whatever. You have to go to the hospital. So the first thing is to go to the hospital for the medical professionals to be able to diagnose exactly what is wrong with you. Yeah.
And how can family members or partners support women who are going through this kind of condition? Should they be isolated? Like what kind of support should they give to the sick patients?
Yeah, so having your partner, a friend, a sister diagnosed with PID doesn't mean you should isolate yourself or run away from the person. I think this is the time that the person needs your help the most, be it financially, emotionally. So you should just encourage the person, be close with the person, encourage the person basically that all is going to be well, because if we catch it early, we can certainly treat it. Yeah, so people suffering from PID need love the most, I would say. So yeah, so I would encourage friends.
The recovery period last?
Come again.
Like how long does the recovery period last?
Well, mostly PID, the symptoms should usually be resolved within 7 days.
Or just
Alright.
7 days?
Yeah,
Okay.
mostly it should be resolving the pain and everything that's subsiding.
Once you've
But it
started the
can go longer.
medication.
Yes, but it can go longer. Yeah,
Okay.
yeah. So with drugs, we will treat you. So as I said earlier, we have outpatient treatment and inpatient treatment. So if we give you the drugs for the outpatient, you are expected to take it. If we see that in like 72 hours, you have not improved, your condition is still the same, then it means we have to admit you. Probably there is something else going on. So we have to do further investigation. Yeah, so I think the what do you call it, treatment of PID is, I don't know how to put it. It depends on how well the person responds to the medication that is being given. Yeah.
This was really helpful for me. I've learned a lot. There are so many things that I wasn't familiar with, especially the technical jargons that we've used. And
What?
I'm guessing the technical jargons that were used in the
Oh, okay.
conversation. Yeah, the health technical jargons. Yeah.
Okay.
Yeah, I'm sure in our next episodes, like I'll bother you so much. Like every time you say something, I have to pause so that we explain it, and
That is
all the
fine.
layman listening to our podcast can get to have a good feel of the conversation, so they don't feel left out, right?
Okay.
And it seems like we were focusing mostly on women, and the men too can have this kind of illness?
So pelvic PID is ladies issue.
Pelvic disease.
Yeah.
Yeah. But our
But
series, we are tackling the infectious diseases,
yes.
and I'm guessing it's going to be a series of conversation where we'll be talking about different infections that people encounter. And so, for the men who were listening to this podcast and they feel left out, you are never left out. You probably have like your spouses or your daughters or your
So I think the
girlfriends whom you can share the
let me just
recordings, get to learn more about these things.
okay. I was gonna say I think the best thing a guy can probably do to save his woman from PID is to also not go around sleeping with other people, or sleeping with other people. He's going to he's going to
You can
put
bring the
himself
bacteria.
contract it and bring it to his woman. So in as much as a guy won't have PID, a guy can help at least save his woman.
So you heard from Dr. Sethi say that even you two don't be sleeping around because you don't want to infect your spouse or your friends whom you might be sleeping with. And so, yeah, for me, my main key takeaway from this conversation is that this is I think it's one of the most dangerous diseases a female can really have, especially the fact that it denies you the chance to get pregnant and have a family just like every other family. So if you really want to have a family and you're interested in that, and don't take this conversation seriously, don't be sleeping around. If you have any symptoms, hurry, like go to the hospital, make sure that you seek the necessary care. And yeah, we'll see you in our next conversation. We'll have a series of different infectious diseases with Dr. Seth. He will be describing different symptoms and signs that you have to be looking out for in your day-to-day activities, so that you're able to seek care when you need it most. Yeah, so thank you so much, Dr. Seth, for coming. It was a pleasure to have you here, and yeah, I'll see you next time.
All right.
And to our listeners, thank you for staying tuned. We have more episodes coming up, so subscribe, like, share, and yeah, we'll see you next time. Bye bye.